So I think we're going to move into introducing our first speaker. And I'd like to introduce Dr. Dean Ruether. We're going to hear from Dean as our resident oncologist today, and he's going to share in terms of late and long-term effects and the impacts that many people will experience. And Dean grew up here in Calgary, and he always knew he wanted to be a doctor like his father. His father loved what he did, and Dean feels the same way about his work now. Dean studied medicine at the University of Alberta and completed postgraduate specialty training at the University of Calgary in hematology. And he joined the Cancer Control Alberta team in 2000 and has developed additional specializations in genitourinary, endocrine, and neuroendocrine oncology as well. In addition to seeing patients and families here at the Tom Baker Cancer Centre, Dr. Ruether is also the Medical Director of Community Oncology, supporting clinicians in our regional and community cancer centres around Alberta. Dr. Ruether loves his work, is passionate about patient care and making it easier for people to get cancer care closer to home. We appreciate him making the time for all of us today because he is hitting the road and going to a community oncology conference right after our symposium today elsewhere in the province. I'm told that Dean's favorite food is Indian, and his favorite activity is perhaps running between clinics and meetings and our many cancer centres around the province. He travels quite a bit. So this is a really excellent opportunity, Dean, to spend some time interviewing you. So this is, we like to call this our fireside chat, and really an opportunity to just kind of ask you, hopefully, the kinds of questions that others in this room and across the province might be wondering themselves, and really hearing from the experts. So it's a pretty big topic, though, late and long-term effects after treatment. And I'm wondering, because everyone does experience after treatment differently, how would you describe in general the kinds of things that people might be experiencing, and what is a late and long-term effect?
Sure. So for the clinicians who care for patients, we think about side effects and problems related to treatment as acute, those that occur in the hours, days, weeks around treatment, immediate or short term are ones that can linger and go on for up to 6 months, and anything that goes on sort of after 6 months and maybe something that someone has to deal with for years after treatment as a chronic side effect of treatment. And these can be, it can affect any organ system in the body. Really depends on what kind of treatment you're getting. Radiation treatments tend to cause side effects associated with the site that's being treated. Different chemotherapy and immunotherapy treatments target different parts of the body, and so side effects do tend to be specific to the types of treatments that are given to people. And we hope we give some people some sense of what to expect in the short and long term when it comes to dealing with the consequences of treatment before they get started. But there's a lot of information that people have to deal with, and sometimes that part of the conversation kind of drifts to the back, and you don't really recognize the consequences of the treatments until you're dealing with them at some point later.
Thanks. That makes a lot of sense. And I know a lot of psychologists and social workers and spiritual care clinicians within cancer care often see people who are, at that stage of finishing treatment. And often they struggle just feeling like they're sort of feeling like they should be moving on, quote unquote, but certainly that's not what they're feeling. People don't often feel they're quite there. So I guess it also sounds like it's a lot of those late and long-term effects are a natural part of the recovery process as well.
Very, very definitely. You do have to respect what your body's telling you. You've been through something very difficult, very challenging in many ways, physically, emotionally, spiritually. Those consequences are going to be with you for a while. But we do want people, our goal is to get people back to normal life. But that takes time. That takes weeks after treatment is finished. So you shouldn't expect that, 3-4 weeks after I'm done treatment, I should be back to myself. It's often several months before people really feel like they've got their feet back under them and they're back to some semblance of normal activity. So be patient with yourself, give yourself the time that you need, but it is important to push a little too sometimes.
So that, yeah, I mean that it just takes time. I'm hearing that it being an important message, but that doesn't mean that you can't do anything to support well-being. Let's just dig in then. I'm wondering if we can kind of think about the body and think about the different systems in the body and how these systems might be affected after cancer treatment.
For sure.
What people might notice and what they might reach out to sort of help themselves cope with those effects. So maybe starting with the brain and nervous system.
Sure.
What are some latent long-term effects in that?
The acute or shorter-term things we hear from people going through chemotherapy treatment, sometimes with radiation as well, is effect on concentration, memory, ability to keep myself organized, sometimes called chemo brain. It's real. We don't necessarily understand what it is that causes it, how much of that is related to the treatment and the impact of the actual treatment itself, and how much of it is that you're dealing with something that is so unfamiliar, unexpected, in circumstances where there's often a sense of a loss of control, things happening to you and things that you don't necessarily have a lot of control over. I think that contributes to those problems. That, again, is not a surprise to hear. You need to be patient with yourself. There are things you can do, though, to address those concerns. And a big part of that is staying physically active and getting the rest that you need. We know that a lot of things we do often disrupt people's sleep. And it's very common for patients to complain while they're going through treatment that, I'm really having challenges with my sleep. I can't get to sleep at night. I can't stay asleep, or I wake up early in the morning and can't get back to sleep. That is going to affect memory, concentration, ability to stay organized. So being cognizant of the important things to do when it comes to sleep hygiene, things we should all be paying attention to and that many of us are not good about. So looking at a computer screen late at night, laying in bed watching your iPad, that blue light from that screen is not conducive to good sleep. Getting into habits of a regular schedule. So, I'm go to bed at 9:30 at night. I set my alarm for 7 in the morning, trying to maintain a schedule that helps you to maintain normal sleep. None of these things are going to completely eliminate those problems, but they can help to make them less of a challenge. We hear from people too, very commonly, that mood is impacted. It's problems with depression, feeling blue or down. Again, not a surprise given the circumstances you're dealing with. And there are some of our treatments that can impact mood. And I tend to think of that issue as one associated with the brain. It's important to make your care providers aware if you have any previous history of problems with depression or anxiety. We need to know about that before we start treatment because we want to be aware that we may be impacting something that is a pre-existing problem. There are strategies that we can help you with to deal with those issues. And if those problems come up, we have access to our psychosocial program. We have a group of psychologists, social workers, psychiatrists who work with us, work entirely with cancer patients and are very familiar with the issues that they bring to the table. And so you've got access to lots of help and support. Sometimes that includes medications to deal with those issues, but there are things that you can do, again, staying physically active, paying attention to sleep and sleep hygiene, staying socially engaged at times when you sometimes feel like you just want to pull in and not deal with people. Stay engaged in your normal social circles and normal activities. There are going to be days when your body says, today's a down day, I need to rest. But a little bit of physical activity every day, even if it's taking the dog out for a walk, is a good way to try and keep yourself mentally healthy.
You just shared a whole bunch of very useful information just about the brain and nervous system impacts, especially on thinking, cognition, as we say, but also some of the emotional impacts that are very expected often. And we see actually that sometimes, surprisingly, after treatment, that those distress levels can increase, feeling blue, feeling down. So thanks. And I'm wondering if we can shift to a different body system. So thinking now about actually combining two systems, I guess, cardiovascular system and respiratory system.
Yeah. So again, our treatments can have an impact. There are drugs that we use that can affect the way the heart functions, both short and long term. There are treatments that we use that can affect the way your lungs function, both short and long term. And my message would be very similar. Make us aware of any pre-existing problems. So if you have a history of high blood pressure, cardiovascular disease, diabetes, stroke, if you are a smoker, have a history of problems with your lungs, we need to know about those things because that sometimes impacts treatment decisions that we would recommend to you. It also brings up issues and things that you can be doing to help yourself. Probably the single most important thing you can do if you are a smoker, quit. That's, if there was one piece of advice I would give to people who come to the cancer clinic, if you are a smoker, you must quit. We know that smoking is linked to a number of different types of cancer, but it's also linked to how people do in getting through treatment and how well they live afterwards. People who continue to smoke through treatment and after don't have as good outcomes as those who quit. So again, quit smoking. There's no good reason to continue. And we can help with that as well. An awareness of previous problems related to cardiovascular disease is important because there are things that we can do to potentially obviate the impact of our treatments if that is a concern. And similar to the previous discussions, stay physically active. That's probably my second piece of advice to people, is that if you maintain some level of physical activity on a regular basis, you're going to handle your treatments better, you're going to have less trouble with fatigue, less trouble with nausea, maintain better appetite. All of those things are related to regular activity. And you don't need to be running marathons or pushing a huge amount of weight. It's just a little bit of physical activity every day, even if it's a 20-minute walk or in the winter, walking around the shopping mall. Maintain some level of physical activity. It will help you in getting through treatments and help you deal with the concerns that can come afterwards.
So being active can really help with the impact on the cardiovascular system, the respiratory system, and so some treatments like radiation and chemo affect those systems, and that the activity and quitting smoking are your two key points there.
Definitely.
Okay. Shall we move to the digestive system?
Sure. So I think that the biggest challenge we often see there acutely and for a period of time after treatments is the impact of our treatments on appetite in general. And that can be because of nausea related to treatment. It can be the impact of other medications. If you're using medications like opioids to manage pain that can cause problems with constipation, that impacts people's appetites. Some of our treatments, if you've had surgery, say a portion of bowel removed because that was where the cancer was first found, that can impact your ability to absorb nutrients. Those are things that we are aware of. We also need to make sure your family doctor is aware of, because sometimes there are issues that are going to be a long-term consequence of your treatment because of shortened bowel, the impact that has on ability to absorb water, and tendency towards problems like dehydration. It's important to try to maintain some good nutritional intake. Again, there will be days when your body says, not feeling terribly hungry today, I'm just going to focus on keeping up my fluid intake. You have access through our program to nutritional support, counseling with dietitians, and for patients in certain types of patients where we know intake is going to be a big challenge. For example, patients with head and neck cancers often have major problems with their intake both during treatment and as a consequence afterwards. We try to build in assessments, evaluations, and support from our nutritional services.
Speech language pathology also
pathology
plays
is
an
another
important
good
role for helping with the eating, swallowing, and speaking. Yeah.
Yeah.
Thank you. You're reminding me too that a lot of these systems are, I guess I'd ask you, could they be affected by stress as well?
Definitely. Appetite certainly is. Some people eat to relieve stress. Some avoid food or shy away from food because their appetite is affected. Recognizing the role that stress is playing in that is important, because the key there is managing the stress. And that may be talking to your care providers about what it is you're feeling and how we can help you to deal with that. It may be that bit of physical activity that's needed every day to help alleviate that. There's lots of different strategies. But understanding the role that stress and distress is playing in how you are feeling is important.
We're fortunate today. We'll soon hear from Dana Mail all about sort of the emotional side and more information about that as well. The immune system. No, skipped one. Musculoskeletal system.
So weight loss is pretty common in many of our patients as they go through treatment, and often the weight that is lost when people aren't eating well is the good weight we want them to hang on to, so it tends to be muscle. And some of that is unavoidable. That's going to come with treatment. But again, staying physically active, paying attention to your nutrition is going to help to obviate those concerns. An element of that perhaps relates more to the nervous system is the impact of some of our drugs on peripheral nerves. So we can use drugs that cause what we call a neuropathy and can affect sensation, balance, strength in the hands and feet. That can affect musculoskeletal health, balance, increase your risk for things like falls. So if you're receiving a treatment that we know is potentially associated with that risk, your doctors and nurses will be asking you, are you noticing any tingling in your fingertips or toes? Any weakness? Are you dropping teacups or coffee cups? How has your writing changed over the period of time that you're on treatment? We're looking for clues that suggest that our drugs are causing problems with neuropathy and that we might need to intervene to prevent that problem from becoming something that is chronic and potentially painful.
So that intervention, when you mentioned we might intervene, what could that look like?
Sometimes that means changing drugs. So stopping a drug that we know is an offending agent and moving to an alternative. Yeah.
And sometimes I know there would be referrals as well to receive physiotherapy or occupational therapy to support the goals with increased mobility and function physically. Just that extra professional support to get to reach your physical goals as well. And that can be an important piece of pain management as well.
And there are other health issues that our patients bring to the table. So if you have diabetes, you're at risk for peripheral neuropathy because of that disease. We can add to those concerns with the treatments that we bring on board. We may not be able to, if that treatment is necessary, that is a risk we may have to live with. But if tightening up the management of your diabetes is something that needs to be addressed to try and obviate those concerns, then that is something we can do.
And the immune system, what are some of the impacts to that system of the body?
So the most common concern we hear from people is, I'm on chemotherapy and so I can't can't go to the shopping mall. I can't go out to the restaurant. I can't be around people out in the environment because I'm going to catch a cold or a bug, and it's going to interfere with my treatment, or I'm going to get very sick from that. Very important for people to understand who are going through chemotherapy treatments that the risk for infection comes from the organisms we carry around in our body, not what we're exposed to out in the environment. We would like people to avoid being around others who are obviously ill when they're going through chemotherapy treatment, but you should not isolate yourself with the thought that walking by somebody in the shopping mall who's coughed, I'm going to get sick. It's the organisms we carry around in our body, not the ones that you might be exposed to out with in casual contact out in the environment. And those concerns tend to be acute ones as people go through chemotherapy treatment. Our treatments cause blood counts to drop, and at the time when the white blood count in the body is low, organisms we carry around in our bowel or in our lungs could cause a problem with infection. Long term, for most patients who go through chemotherapy treatment, we do not have an impact on your immunity. Your immunity and ability to fight infection returns to normal after our treatments. The exception to that would be patients who go through bone marrow transplantation. And for those patients, we certainly have an impact on their immunity, and you may need to go through a period of re-immunizations. Receiving some of the immunizations that you received as a child, those things may need to be redone because you have a new immune system with that new bone marrow that needs to be trained to recognize these pathogens. And then the other newer piece is related to what we call immunotherapy. So there are a new group of drugs been using in the last few years now that help our immune system to wake up and recognize a cancer as something that it needs to attack. Cancer is very good at hiding from our immune system. And there's a new class of drugs that are having a huge impact on the treatment of many types of cancers by waking up the immune system and identifying the cancer as something that the immune system needs to go after. The downside of those treatments is that we can sometimes cause immune-mediated side effects. So, and these can affect any organ system in the body. Most commonly, they affect the skin, the bowels, the lungs, but virtually any organ system can be impacted by an immune-mediated side effect from these drugs. And if you are going to be treated with immunotherapy, you'll be given educational material, things to read about these various drugs, the things to be watching for when you're on treatment. These can occur while people are on treatment. They can occur weeks, months, even years after treatments with immunotherapy have been finished.
Thank you, Dean. And I wonder, I'm curious how often you get the question, is there anything I can do to boost my immunity or help with that?
Yeah, that is a common question, and there's a lot of anecdotal information out there that would suggest there are things you can do to boost your immunity. A lot of that, as I said, is anecdotal. There's not a lot of solid evidence to say that eating a certain way or that certain types of behavior will boost your immunity. Probably the simplest thing that you can do to protect yourself from infection and that family members can do is good hand washing. Obviously, trying to avoid being around people who are ill with a cold or flu or infection when you're going through treatment is advice we would give to people. But are there things that you can do with what you eat or drink that are going to boost your immunity? I think that's questionable.
Okay, thanks. Last system of the body, but not least, reproductive system and sexual health. Could you tell us a bit about those late and long-term effects?
Very important. So, and it's a big topic. There are definitely treatments that can impact a person's fertility. Chemotherapy, radiation treatment, hormonal treatments that are used in the treatment of breast cancer, prostate cancer, can impact an individual's fertility and ability to have children. And if it is an important issue for you in a discussion about treatment, what could this kind of treatment do in terms of my ability to have children subsequently, you should raise that. That is something we should also be bringing up with you if it's a concern. And there are some patient populations where this is commonly part of the discussion. Young men dealing with testicular cancer, women dealing with ovarian cancer, women going on to breast cancer treatment. Common for us to talk about issues related to fertility. And there are things that can be done, sperm banking eggs prior to treatment, that can help to preserve those fertility options for people afterwards. The other impact that our treatments have, I would classify more broadly as an impact on sexual health and our identity. So we do a lot of things to people that impact how they feel about themselves in terms of their attractiveness, their sense of being a whole person, and that can have profound impacts on how we relate to intimate partners and create huge challenges for intimate relationships. Those are often short-term things, but many of the things that we do to people are things that they have to live with long-term. So a good example would be the impact of a mastectomy for a young woman dealing with breast cancer. That surgery can have a huge impact on someone's mental health and view of themselves, and can interfere with intimate relationships. It's important to recognize it. It's important to talk about it, and it's important to take advantage of the resources that we have available to help people negotiate for themselves, with their partner, around how to deal with those problems.
Excellent. So where should people go if they want more information about later long-term effects, or who should they talk to?
I think it's important to talk to your care providers, your physicians and nurses who are taking you through treatment, because they'd be best situated to talk to you about what the specific short and long-term effects of your type of treatment could be. Remember that we talk to you about things that could happen. They're not necessarily things that are going to happen. We have to warn people about what may be coming, but just because we raise it with you or because it's on a piece of paper that describes the treatment that's coming up doesn't mean that that's what's going to happen to you. I think it's important to talk with your family doctor about it. After you're finished with care in the cancer program, you will have an ongoing relationship with your family physician, and many of these issues are ones that are not unique to patients with cancer. Your family doctor is a good resource. And then, as I said, our psychosocial services, the program that is available to you through the cancer clinic, is available to you and family through treatment and after treatment, at any time after treatment, if you've been a patient of the cancer program.
So there are services, certainly, and it can be daunting to ask, but that I'm hearing the message important.
Very important.
Important to ask and to have some of those more difficult conversations. And if you were to have one take-home message today, Dean, about late long-term effects and how to manage the impact.
I think I think it would be that there isn't a magic pill, but the things that you can do are the things we should all be paying attention to. So don't smoke. Moderate your alcohol intake. Pay attention to your diet and your weight. Stay physically active. Stay socially engaged. Those are things we should all be paying attention to in relation to how we manage our health. I think that, I guess the other piece of advice I would give to people is be an active participant in your care. There are lots of things that happen during this that you have no control over. And some of it is just accepting that I've got to get through this. But you can be an active participant in your treatment, and taking back some of that power and that control is very helpful in managing what is coming with cancer treatment and what comes afterwards.
Thank you. I think you've given a really helpful, inclusive perspective of whole person experience after treatment. Thank you.
Thank you.